Okay, let me just get some quick feedback. What we've covered so far, has it been useful?
Yes.
Worthwhile?
Yes.
I mean, I got to tell you, I'm already getting behind. And when I presented to the CPIN leads about a month ago, I still had bunches of stuff that I hadn't even covered, and so they told me today, at least try to get through the topics in your outline. So I may be moving us on, but I just wanted to make sure that the things we've talked about so far, you've been finding valuable, and that's good. Now, what's always useful when you take a break, of course, is the questions that come up. And so I wanted to respond to two in particular that really built on some of the things we've been talking about. And it has to do with, what does brain-based learning look like? First of all, I've got to tell you that having described to you that very passive model of filling up the empty vessel of my students' minds with knowledge as being the model we use in higher education, what I've learned about developmental neuroscience has changed my teaching. So one of the things I try to do, if I can, is to stimulate students' interest in the topics that I cover in my psychology classes by having them think about their own experiences, by having them recall what they already know about the topic, sometimes by presenting them with a provocative question or a story or something that has been in the news recently. But the idea is that if I can get their brains active, and if I can get those memory and learning networks already engaged, then I have a much better chance of providing new learning than if I simply go ahead and present a topic from my own agenda. So in that respect, I think the developmental neuroscience tells us a lot about learning across the spectrum. But the other thing that it tells us is equally important, which is that a high-quality learning environment looks different at different ages, because the brain is at a different stage of development. So we really shouldn't expect a high-quality early childhood learning setting to look at all like what a high-quality learning setting for a 5th or a 6th grader to look like. And that should be different for what a high-quality learning setting looks like for a college student, because the brain is at different stages of development. And indeed, that's exactly what the research evidence shows us. So in remarkable studies by Deborah Stipek, who's now the Dean of the School of Education at Stanford, she has shown that if you create for preschoolers a setting that is a lot like a 4th grade classroom with an adult-directed agenda, with kids doing a lot of individual work at their seats, with a minimizing the amount of peer interaction that goes on, with a lot of focus on what the teacher is telling them, you not only do not have preschoolers learning more, you have them learning less, you also have them feeling more frustrated and less confident in their abilities to learn. By contrast, of course, most of you know that the cardinal rule of a high-quality early childhood learning setting is that, by contrast with a 3rd grade classroom, if you walk in and it's quiet, there's something wrong. Because the way in which the brain at that age is oriented toward learning is very much wrapped up in the social experience with peers, with teachers, capitalizing on children's interests within the context of a developmentally appropriate curriculum. Again, lots of social interaction with teachers who are exploiting learning opportunities they have structured into the classroom environment. And as Janet and I are working on curriculum frameworks based on the social-emotional foundations, part of what we're trying to draw people's attention to is not only the active, thoughtful strategies that teachers can use to facilitate social and emotional growth in children, but the ways in which the whole ecology and environment of the classroom can facilitate that when it's thoughtfully designed in ways that you all know how to do. So all this are some of the ways in which what developmental neuroscience tells us about brain development really has practical applications for how we think about ways to facilitate early learning and cognitive growth. Is that helpful? Well, let's turn then to the other side of the brain development story. And again, I think part of the story that you'll be hearing more about as we are learning more and more about the vulnerability of young children's emotional lives. And it has to do with the effects of stress. One of the things we're learning is that chronic or severe or uncontrollable stressful experiences, what I will call in a few moments toxic stress, can lead to a shaping of brain systems that respond at lower thresholds and can impair learning and memory. Part of the story of developmental neuroscience is that our brains, stress-responsive systems, the systems that activate our bodies, that secrete stress hormones into the bloodstream, are toned, are calibrated, are adjusted according to the stressfulness of early life experience. This is not just true of brain stress systems. It's true of many other systems in our bodies. It's as if our development is organized in such a way as to take cues from early experience to say, oh, so that's what life is going to be like. And our physical systems and our neurobiological systems become adjusted accordingly. So that children who early in life face chronic stressful experiences have biological stress systems that go, oh, I've got to be ready for a dangerous, threatening world. And not surprisingly, these are the kids who overreact when they are faced with what might otherwise be seen as benign or insignificant threatening events. These are the kids who tend to fall apart when they're highly stressed. These are the ones who have difficulty maintaining the ability to cope when they are actually in dangerous circumstances. And it's because their stress-responsive system has been altered by the early experiences they faced. There's even some evidence that prenatal experiences of maternal stress, as we had talked about earlier, can have a similar adjusting effect on the brain system. Now, the reason this is important for us who are concerned about early learning is that how your brain responds to stress is important not only for how you function emotionally, but for your capability to learn. And that's because the secretion in the brain of stress hormones, as I mentioned earlier, hormones like epinephrine, norepinephrine, cortisol, are really wonderful for getting us activated for short-term stress responses. If you were somebody living in the dawn of our species evolution, and you saw a jungle cat who just spied you warily, it was great for cortisol to leap into your system so you could run like heck to get out of there. But the fact is that those same stress hormones, when they are continuously being secreted, when they are part of the chronic, enduring internal environment of the brain, have toxic effects. Very much the situation here is very much like the first car that I owned, which was a beautiful little MGB Roadster, which I discovered to my delight as a young adult male had overdrive. The only moving violation I got ticketed for was when I drove that car. But I discovered that overdrive is great for giving you a surge of power when you need it in the passing lane. The problem, as I discovered, is you can't drive that car in overdrive all the time. It burns out the engine. And that's exactly how our brains respond to chronic stress. Now, to sharpen this issue, we need to be very clear about what we mean by stress. Because, in fact, not all stress is harmful. Not all stress is toxic stress. And to even take it a step further, a lot of stress is developmentally essential and valuable. So we can make a delineation between three kinds of stress. We might consider first what I would call positive stress. And these would be moderate, short-lived stress responses that cause brief increases in heart rate and mild changes in stress hormone levels. These are the kinds of stressful experiences that help to toughen us up, that help our bodies to be prepared to cope with threatening or dangerous events. Causes for young children might include things like the challenges of meeting new people, dealing with frustrating events, getting an immunization, adult who insists on limit setting, those kinds of things. And what's really important is that these are important and necessary aspects of healthy development, especially when they occur in the context of stable and supportive relationships, because it's the relationships that help you cope with them. It's the relationships that help you adjust constructively. Moving along in the continuum of severity, we might consider a second kind of stress that I would call tolerable stress. These are a little bit more disruptive. These are stressful responses that in fact could disrupt brain architecture. But they are, here we go again, buffered by supportive relationships that facilitate adaptive coping. It's the idea of someone being alongside you to help you through it that helps to modify and dampen the potentially damaging effect on brain architecture of stressful experiences that are a little bit more severe. So what we might consider as to be causes of tolerable stress might be things like the death or serious illness of a loved one, where there's someone else there to help you through it. A frightening injury, a parental divorce, even terrorism or a natural disaster or homelessness, if there is someone there to help you through it. And indeed, this is exactly what the research is showing us. Children who had their lives overturned by Hurricane Katrina. It made a lot of difference if there was a well-functioning adult helping them through it. So the characteristic of tolerable stress is that they generally occur within a time-limited period, which gives the brain an opportunity to recover from its potentially damaging effects. The kind of stress we need to be most concerned about is what we call toxic stress. This involves strong and prolonged activation of the body's stress management systems in the absence of the supportive protection of adults. Causes might be extreme poverty, physical or emotional abuse, chronic and serious neglect, enduring maternal depression, family substance abuse, family violence. And notice that the common denominator of all these potential causes of toxic stress is that the supportive people who might otherwise help a child cope are absent. That they are either the sources of the stress or other circumstances are undermining their abilities to help children. That's much of what makes it toxic. And the concern we have is the ways in which toxic stress can disrupt brain architecture and lead to these stress management systems that respond at relatively lower thresholds, thus increasing the risk of stress-related physical and mental illness. We actually see the effects of this kind of stress on brain architecture. So if we consider, first of all, areas of the brain, what we call technically the prefrontal cortex and the hippocampus, which have to do with the areas of the brain centrally related to learning and memory and self-control, we find that where stressful experiences occur that are within the normal range, these areas of the brain are interconnected in a developmentally appropriate fashion. We see these areas of the brain developing normally. But for children experiencing chronic stress, the areas of the prefrontal cortex and the hippocampus are impoverished in their interconnections. Their development has been impaired because of the effects of stress hormones on these areas of the brain that facilitate effective learning and problem solving. By contrast, if you look at another area of the brain called the amygdala, that is the part of the limbic system that is most directly related to responding to threat or danger, it's the amygdala that has a lot to do with fear and anger reactions. You find that when individuals experience normal levels of stress, again, the areas are connected in the amygdala in a developmentally appropriate fashion. By contrast, for children experiencing chronic stress, these areas are much, much more densely interconnected, reflecting the heightened activation of the amygdala in response to events that children are experiencing as threatening or dangerous. We see these effects neurobiologically, but what's important is that we also see these effects behaviorally. Any of you use those computer-generated morphing programs that enable you to start with one picture or object and have it progressively transform into the other picture or object? Well, that's essentially what these researchers did in this particular study, where they took typical exaggerated pictures of facial expressions of different emotions, and then they morphed them into different emotional expressions. Okay? At the top row you have happy expressions progressively transforming over 11 or 12 progressions into a fearful facial expression, or a happy expression progressively transforming into sad. In this case, angry expressions progressively morphing into fearful or angry, morphing into sand. Now, why is this important? Because in this study conducted by my colleague Seth Pollack at the University of Wisconsin, they asked 9-year-old children to identify the expressions in each of these spaces when they were presented in random order, not in the order in which they're presented here. So just in random order, kids were asked, so what is this person showing on their face? What are they feeling? And the results indicated that for faces depicting anger, children with a history of abuse tended to identify anger in the face much earlier than children with typical experiences did. Okay. So even though most of us would look at this face, and although it has some anger components, it's still basically a sad facial expression. These kids were so hypersensitive to the perception of anger in adults around them. They were already beginning to see this as an angry face. Whereas kids with more typical experiences, as you would expect, began to see the face as angry about halfway through the morphing progression. Okay? And Pollack has also identified the particular brain areas that relate to the detection and the mobilization of attention to threat as being hyperactivated in children with a history of abuse when they're seeing these facial expressions. So I mention this because this is one of these areas in which we can see what the effects of stressful early experiences are on both brain neurobiology and on behavior in ways that really make a difference. And you know, of course, because you've seen kids like these, that these are the kids whose ability to concentrate, whose ability to get along with others is often impaired by their hyperreactiveness. In the case of these children, to others being angry, and perhaps an adult being prepared to maltreat them. In other circumstances, their hypersensitivity to others intruding on them, responding aggressively to them. These are the kids who overreact. You know, it was very much like what my experience was when my parents were going through a painful divorce. And like many other children of divorce, my siblings and I learned to be very, very attentive to signs that the adults weren't getting along. Because we knew that this could be the prelude to a big parental battle and how upsetting that would be. And so what the research has shown is that kids like that, kids with that experience, tend to overreact because they're seeing those small cues, something is going wrong, as meaning something very significant is about to happen. And they get very upset as a result. Yes?
Seems like in your examples and in your conversation that there's both the chronicity, if that's a word, of the stressors and the intensity of the stressors. Yes. Could you sort of make any comments to sort of address those two factors separately?
Yeah, the question is, so are we talking about things being stressful because they're chronic, that is, they happen over and over again? Are we talking about things being stressful because they're severe? Is that the reason they have the impact? And I would add one more factor. Are things stressful because they're uncontrollable? Because there's nothing you can do to get out of it? My siblings and I, we could leave the house, and often we did. But oftentimes, the stressful events that are most significant are the ones you can't escape. There's no way out. All three of those are factors. And of course, they work in dynamic tension with each other. So oftentimes with these children who have a history of maltreatment, we're talking about stressful events that are chronic, that are severe, and that are uncontrollable. And that's the triple whammy. It's a good question. Yes?
Do you have an opposite effect if you have negligent parents, if you have child neglect, child abuse, where you see lack of responding to cues, relationship readings?
Yeah, yeah. The story of child neglect is a much more complicated one. Because here, as you point out, we're not talking about an adult whose anger a child has to be attentive to. We're talking about actually an adult who just does not respond, and that has its own significant effects. But they aren't effects we'd expect to see here, because it's in the detection of emotion in others, where children with a history of maltreatment are likely to be most sensitive. So it's a different effect with neglect. Sobering stuff, isn't it? So the bottom line then is that when we're thinking about early childhood mental health, we're talking about something that is vulnerable to stress, reflecting the vulnerability of children's emotional lives, with significant implications for early learning. And this slide essentially summarizes much of what we've already been talking about. That early signs of depression, post-traumatic stress, conduct disorders, and other problems can be seen in children as young as 2, possibly earlier. We find that for these children most at risk, their vulnerability is associated with family disruption and parent mental health difficulties, socioeconomic distress. Temperamental vulnerability is also important. Children who are themselves more prone to anxiety are going to respond more significantly to family disruption than are children who are a little bit more robust in this way. These children, as I mentioned earlier, are often first identified in early childhood programs as emotionally dysregulated and disruptive. This helps to account for some of the astonishing research that has been appearing recently about children being essentially asked not, or their parents being asked not to bring them back to preschool or early childhood programs. It's not because these kids can't read. It's not because they don't know the numbers. It's because teachers cannot manage the classroom because of it. And these are children, these are the kinds of children who are often coming from these kinds of backgrounds. And therefore, these children are at risk for academic failure. Questions, comments? Yes?
What have they found, with children who have been constantly exposed to war situations? They've got that chronic, severe, uncontrollable stress, but if they've got people who are helping them through that, does that make a difference?
Yeah. Question is, what about children in wartime settings? And it's impossible for us to think about the opening decade of the 21st century without recognizing that in so many areas of the world, in Iraq, in Afghanistan, in sub-Saharan Africa, in parts of South America, children are being orphaned and are abandoned. They're being traumatized by ghastly experiences. I've got a student who is trying to do interventions in an orphanage in a Latin American country. I thought after all this horrors coming out of the Romanian orphanages that was something we were putting aside. But in fact, they are emerging because of the incapacity or the absence of the adults to take care of them. We can only imagine, therefore, what might be the decades later or the more immediate aftermath of the ways in which these brains are being bathed in stress hormones and its behavioral consequences. Now, as your question points out, what the research shows us is that for children in difficult or threatening circumstances, simply the availability of one reliable, supportive relationship can make an enormous amount of difference. As the work on positive, tolerable, and toxic stress tells us, those relationships are buffers for the effects of stress hormones on the brain. Now, here's where my decisions come back and kick me. Part of what I tried to do to refine or reduce the length of this presentation was take out a slide that I would love to show you now. A study that was done of 18-month-olds when faced with a lot of challenges in a laboratory procedure. They were with their mothers, and the security of the mother-child relationship was independently assessed. Also, they had information about children's temperaments. The short story of this study, which I had a slide all ready to show you, was that for children who were temperamentally bold, unfazed by anything, there was very little physiological stress response to the laboratory challenges. But the real concern was children who were temperamentally shy and withdrawn. If they were in secure relationships with their mothers, very little cortisol response. It was only those children who were temperamentally shy and in insecure relationships with the mothers who accompanied them who showed a whopping cortisol response. And that study, which has been replicated a couple of times, is part of what helps us understand the buffering effect that relationships can have in modifying the brain's physiological stress response. Megan Gunner, actually the study was by her student Martha Nachmias, Nachmias, published in Child Development in 1999, I think. How's that for recall? anything else. Can't guarantee I could do that again. Yes.
Let's see if I can formulate my question. So,
Wow.
let's see if I could talk softer now.
Sorry.
For those that are going to be working maybe with older children, maybe 6 on up to 18, and they want to be teachers, is it accurate to say that these children who are experiencing the very stressful situations, that they will always, throughout their life, be in the system, their body, their system, in repair mode, and that that they need to continue to use that buffer of relationships in the manner that they work with the children, and also encouraging that from family. So that's going to be an ongoing. In other words, we're not talking about fix it. We're talking about ongoing. Is it repair or ongoing buffer? Do you understand?
Yeah, I think I do. And it's a wonderful and important question to ask at this point. So I've been painting a concerning story here. I mean, let me just nail it on the head. The children we have to be most concerned about that help to account for the achievement gap are the kids whose vulnerability arises not because of not knowing letter and number skills, but because of social and emotional systems that have developed awry because of their early experiences. And sometimes the best way we can promote early learning is by helping those vulnerable at-risk children. Now the question is, if brain neurobiology is shaped by these early experiences of stress and trauma, does this result in damaged children for the rest of their lives? And here's the other side, the more positive side, about the vulnerability of rapidly developing young brains. And that is that they are more plastic and more flexible and more remediable than they will ever be later on in life. So that part of this story here, and this is why your question is such a good one, is a story of early identification and early intervention as well as early prevention. We prevent as much as we can exposure to these kinds of stresses and traumas and challenges because of their detrimental effects upon the brain. But when we cannot prevent, we seek to identify and intervene helpfully because the brain's plasticity gives us greatest hope for essentially it becoming rewired, retrained to respond more adaptively. In some respects, that's a lot what therapy is all about at older ages. But when you're looking at younger children, oftentimes the interventions you have to be thinking about are multi-generational ones because the sources of challenge in children's lives are arising from family environments. This is why I said earlier that oftentimes it's a preschool educator, a child care provider is the first person outside the family who has become aware that a family is in turmoil because a child is behaviorally or emotionally out of control. But if you can identify those children, and if you can begin marshaling some of the community resources to help both the family and the child, brain's plasticity at this age gives you greater hope that you can be setting that child on a more positive developmental pathway than what they would otherwise experience. And that's where the new research that is beginning to emerge on treatment avenues for children facing these early emotional or behavioral problems is so important and is so promising, because if we can catch these early, we can begin helping to set development aright. Does that make sense? Okay. And that's why your role, that's why what you do is so very, very important. To understand the child who is creating havoc in that classroom may be doing so because of chaos in their home or elsewhere in their lives, that they are often as perplexed by their inability to control themselves as you are, gives us a different window with which to begin thinking about how do we provide assistance. Okay.
Yes? I agree with what you're saying, and but I also think about teacher attitude, efficacy, teacher efficacy issues. Those things impact the stress level of students quite often. I came from a K-12, and now I'm in early childhood, and I'm enjoying it. But I really feel that teacher attitude and expectations is whatever you have in you internally, you can pass on and feel the stress levels of the students, and you send a whole different message. And when it comes time to self-regulate and say, I can do these things and set some goals, they feel that they can't because they've been constantly fed, and I can't mend you at home and at school. And that's a real monster, a real elephant that we have to deal with.
I think that's a good point. There's nothing else I can say to add to that. Anything else? Yes.
Another thing that I think often is considered is the children's fantasy life and how they don't separate reality from fantasy. And so they may have a chaotic home environment, and then added onto that, they may be playing violent video games, for example, where they're not only being passive watching it, which is bad enough, but they're actively taking the role of being violent, and that is absolutely real to them. You know, as young children, they don't differentiate between, you know, killing someone in a video game and that's real, and the characters that are running after them are real. And I've run into a lot of young traumatized children whose homes are so chaotic that that's another layer of it.
Right.
And so their whole sense of safety and trust on both the real level and the fantasy level is completely out the window, and they become addicted to that process too.
And actually what you're saying relates to a question that I was asked at the break about television watching. And, well, given your response, I probably don't need to say much then. Simply to point out that what the developmental neuroscience is also telling us is that brains process television images in very different ways as children mature. The infant who quiets down in front of the set may actually simply be having trouble intentionally disengaging from all that stuff. It's not that they're finding it interesting or useful. They literally can't break away. That's not good. But also how television exposure is shaping children's images of the world, as you were pointing out. So the recommendations that come from the American Academy of Pediatrics about no television before age 2 are probably wise. Substituting social interaction with a sensitive adult for any time that children spend in front of the television is great. But if children are watching shows like Sesame Street, to do that in the company of an adult who can help interpret and enliven that experience is wonderful.